As you know, we have prepared guidelines to that effect, guidelines which were prepared in conjunction with Ministry of Health and Ministry of Interior, and ours is generally to try and make sure that these guidelines really assist so that within those gatherings, which are necessary and at the same time very important, doesn't become an opening for, God forbid, the loss of life from among our congregants. We have had this discussion because we know what has happened in the western part of our country, where the cases, the COVID cases, have risen drastically. And we take reconnaissance to many reactions and feelings of many religious leaders, especially in this area, in this region, due to the necessary measures of restriction that were given and issued by the government during this time. We have had discussions so that some of those issues we may have a moment to review how effective they are, and at the same time give great respect to that right and unnecessary support and avenue of hope for our people, that is worship and the possibility of worshiping even as gathered congregations. I believe that we have made a lot of headway, and we asking first and foremost that our religious leaders be still at the front line in terms of the fight of COVID, in ensuring, encouraging, helping all our people and in our congregations to follow those measures that we all know are given to us by the Ministry of Health and also in our places of worship. At the same time, we take into account those statements and feelings of many of the religious leaders, especially in terms of helping our political leadership and others, so that at the same time we're working together, even in terms of business, even in terms of for the good of our country, development. Let us have as a first concern the lives of our Kenyans. And so it is something that has been raised by many of the religious leaders in that region, and we have discussed and seen how we can integrate it as we look forward into how we review some of those measures in a way that is both going to address the issue of containing any spread, as Dr. Mwangangi has just said, and at the same time without undue restriction to the worship and the possibility of worship in these areas. I would like to end by saying, remember that COVID is not something we wish upon ourselves. It is something that has come upon us, and sometimes we are going to do things that are not comfortable. But in so doing, once more today, we have reinforced the idea that this will be in coordination and taking into account very much the central role that the religious leaders and the faith groups have within not only fighting COVID, but within helping our communities to live up to much greater standards, both in terms of relation, both in terms of respect, and also in terms of citizenry, because that is what religion also brings through the interaction with our people. So we ask our religious leaders patiently to continue following these measures that have been given as we look into what we are able to accommodate. And as we all know, there is also always the line of the live streaming, which continues in this time with the 15 that we've always had accepted in that live streaming. And in this context, with very in the times we are trying to still reach with creative ways all our congregants. We thank you and we urge you still. Let us really, really put all the measures necessary to fight COVID. God bless you.
I know that the life of the Interfaith Council is supposed to end at the end of this month, but I will issue a gazette notice later today extending the life of the IFC until 31st of December 2021, so that we can continue this collaboration as we work together. And we believe that we are going to, in a much more institutionalized manner, both ourselves at the Ministry of Interior and our colleagues at the Ministry of Health, we have developed a much more institutionalized way of now working more directly with the IFC as we go forward, because there are many activities that are ahead where our colleagues at the MOH are going to require collaboration with IFC. For example, when we receive more vaccines, my colleague Mercy was telling us this morning, and Dr. Mott, that as we expect to get more doses. We will again engage probably in a more rapid vaccination exercise, and at that time we have to work with the structures of the IFC, and we have to work with the network of the IFC to ensure that we support and secure our people. So finally, as we have always said, this affects all of us. It is that time when as a country we must move forward together as a family and deal with each other as people who are facing this challenge together. We minimize any level of misunderstanding or any level of unhappiness so that we can support our people. At the moment, the objective we are focusing on is the lives of our people, making sure that we do not lose more of our people to this disease. And how we will ensure that happens is we all comply. And where there are challenges in compliance, we consult one another. There is no need to put pressure, too much pressure on each other at this point in time. And for the IFC, I have made assurances here this morning in this meeting, and I'm repeating again in public that we are keen on worship. And we want to relook at these measures and see how best we can go forward, advised by our colleagues from the Ministry of Health, to see how we can actually, how fast we can resume worship in the 13 counties, even as we observe the measures that we are advised we must observe to keep our people alive. So thanks everyone for coming. Thank you again, IFC, and we continue to pray that the Lord Almighty continues to strengthen us, hold us by his mighty right hand, and guides us as we proceed, because this is not one of those we are going to come out just simply by our might. We are going to come out of this only by the grace and leadership of our Lord. And thank you for continuing to pray for our people. And may the Lord's will be done always in our lives, now and forever. Thank you so much, good people, and God bless you.
Amen.